Hi, this is Joanne Conroy, and it's Monday, March 16th. Many of you may be aware that we have started to delay elective procedures here at Dartmouth-Hitchcock and across Dartmouth-Hitchcock Health. There are two specific reasons why we are doing this. The first is to preserve important PPE, which is personal protective equipment. We want to make sure we have an adequate supply if we see a surge of patients who are positive or presumptively positive for COVID-19. These patients need to be cared for in an environment that not only protects them, but protects all the caregivers who are working very hard to return them to health. Dartmouth-Hitchcock Health is proactively reaching out to patients who have elective procedures that will be delayed. Any patient not receiving a call about their procedure should arrive as scheduled. There are some procedures that are not elective, that are urgent, or time-sensitive procedures where delaying would result in adverse patient outcome. However, all of our hospitals are open and all of our outpatient appointments, urgent and emergency procedures continue. The second concern is appropriate staffing. It's not a surprise since many of our healthcare workers have school-aged children. When schools close across the state, they need time to make arrangements to care for those children during the day when they're at work. We anticipated that schools would close as this is an important part of social distancing and stopping the transmission of the virus through communities. It is something, however, that we as an organization have to make sure that we have both strategies and tactics to make sure that when our employees are here working, they're 100% present and not worried about who's caring for their children. Let's talk a little bit about screening protocols. If you come to Dartmouth-Hitchcock or any of our facilities in Dartmouth-Hitchcock Health, you will be asked several questions. This is just to inform the people that are caring for you whether or not you should continue with your visit, and if so, should you wear a mask. It's just a normal precaution so we can keep the institution safe for other patients and our employees. We are currently restricting visitors to one person per patient. This is to protect not only other patients in the facility and your own loved one, but the other caregivers in the institution. We do notice that many people are self-regulating. So people that are elderly and have other health conditions have actually chosen not to visit their loved ones here in the facility. It's important for people that fall into that risk category to actually use appropriate self-distancing and try to stay out of crowds in order to keep yourself healthy. Let's talk about testing. It's been probably the headline across many newspapers across the country. The state is working very hard to expand testing and testing access points across the state. Dartmouth-Hitchcock has been working at standing up our own testing capabilities. Currently, we're going through a process of validating the test, which uses current virus from already identified positives in the state. This is a critical component of identifying people in the community that need to quarantine for 14 days. This will help slow the dissemination of COVID-19 across the community. Let's talk about social distancing. Social distancing means staying more than 6 feet away from other people, avoiding crowded areas, trying to spend more time within your own home rather than out at stores or at restaurants. It also means avoiding handshakes, avoiding hugs, and being very careful with the contact you have, not only with strangers, but certainly with your own family. Business and community members have reached out to me for advice on how to use social distancing as well as appropriate questions to make sure that their facilities actually remain safe for their customers as well as their employees. I would direct people to dh.org, and you click on the image of the coronavirus and you will see all of our videos and you'll see all of our recommendations that we have for people in the community as well as our colleagues in the business community. I'd encourage you, however, to inquire whether or not people have had a recent cold or cough or fever, whether or not they traveled internationally, and whether or not they've had contact with a COVID-19 patient. I think for everybody, this is really a disorienting time. It's not the first time that the U.S. has actually had to deal with something that there was no playbook for. In fact, the American military has a term for this called VUCA, V-U-C-A. And the acronym stands for V, which is volatile, meaning that things can change quickly. U, which means uncertain, that there's no historical precedent for understanding what the future or what the path forward looks like for this incident. C, which means complex, and there are many variables that will actually affect the environment. And A, which means ambiguous, meaning there's not a lot of black and white, there's just a lot of gray, and you have to make decisions sometimes in a gray situation. Well, what does this mean for us? Number one, we have to think both tactically, which is address the issues we need to address currently, but we also have to think strategically. What's going to happen 6 weeks, 8 weeks, 12 weeks from now? And how can we actually restore normal operations at that time period? And what are the things that we're going to have to attend to in the community that we really haven't anticipated because we've never seen it before? We have a group of people in Incident Command that's connected to leadership that's trying to consider not only how do we address the urgent, but how do we think about the future? I want to remind everybody it's really important to take care of yourself. We need you strong and well rested if you're delivering care at any of our facilities. We need you healthy and aware of social distancing and how to keep your friends safe for any member of the community. And we need you to remain kind of confident and optimistic. Remember, there's so many things that we as a community can do for others to help right now. That means, number one, washing your hands. Number two, thinking about social distancing. Number three, reaching out to elderly people in your community who may be afraid to go to the supermarket or go to areas where there are significant numbers of people to get things that they absolutely need, either medical supplies and or food. What we're dealing with is temporary, and the path of these pandemics indicate that life will get back to normal in the future. However, it's remembering to stay healthy and energized and present for the people that need you in your home and the people that need your support when you're at work. We want to remind everybody that if you have symptoms, however, contact your PCP. Many of your primary care providers want to talk to you over the phone first to assess your symptoms, and then they will direct you to an appropriate testing facility where you will be able to be tested. So I want to thank all of you. I know this is a disorienting time for many of you, but be kind to yourself, appreciate your families, and support your communities. Thank you.